morning and welcome to an amazing series. Today we are on the Pamper Yourself series 3. I'm sure most of you who have joined in, you know about our Get In Get Fit series and our Pamper Yourself series. But for all those who are getting in for the first time, I think, it is our duty to help you all, understand what we all started this for. I'm sure now we have come almost a 1 year round of the pandemic, right? And at the onset of the pandemic, we all just felt that we were socially disconnected. So the whole idea was to set up a WhatsApp group so that we all could interact with each other. And then I had created a Zoom link so that we could socially at least meet each other on the Zoom platform. And we started doing some form of physical exercises in the morning. And this was between like-minded friends. So that's how it started. And it was not a very structured program. But then almost towards July, we realized that, we needed to take this a lot more seriously. And from August onwards, we started this Get In, Get Fit series. So when I say get in, get fit, I don't mean only physical fitness. I also mean fitness of the heart, body, mind, and soul. So that is how we started. And this was the agenda on Mondays, Wednesdays, and Thursdays, morning 6:30 to 7:10. We have yoga and breathing exercises, and that has been monitored by Suryama. And on Tuesdays, we have meditation and inner healing, and that is by Dr. Sonali. And now we have the dance on every Friday. So Monday to Friday, we are occupied in the morning, 6:30 to 7:10. Anybody interested could always ask us for the link. We'll be able to share them. And we also have a WhatsApp group where we have a 365-day challenge. And this is just to give you an idea of getting into a fitness regime. And we post some exercises and we expect you to do it and just post a feedback or an accountability message. And this is just to, help each of us get into a fitter version of ourselves. And why all this? This is a small initiative by our team Red Rockstars. We believe that in the next 1 year, that is by the time we are 365 days, we want 10,000 people to have got into some kind of physical fitness because of this. But there's a famous quote in Tamil which says, Agathin Alaga Mugathil Theriyum, right? So we said, why only internal health of fitness? We will have external beauty also. And that is how we started our Pamper Yourself series. We announced the inauguration of this series in the 25th episode of the Get In Get Fit series, which was on Jan 16. And then we started the Pamper Yourself series just on February 13th because we felt the month of love. And we started and I was the first speaker. And after that, last week, we had a Pamper Yourself series 2 that was on oral care because it was World Dentist Day. And today we are going to have an amazing lecture by Sainath. So Sainath has been my student and I take great privilege in introducing it that way. It is like, Guru Aminjina Shishyan, right? So that is how I feel Sainath has grown so much today. I still remember when he was in the final year and house surgeon, how for a surgical procedure, he said, ma'am, I want to assist you. And we did a procedure together and it almost lasted for about 2.5 hours. And little did I know that those nimble fingers at that time is going to become, masters in maxillofacial surgery. And when I say maxillofacial, maxillo means, the jaws and facial is obviously the full face. And he went on to do many more educational qualifications, which I'll be reading out in his CV. And what thrills me is, to know that that small bud was started during our college days. And now I can see him as a accomplished maxillofacial surgeon. And Prashanti, his wife, is also one of my students. And a very close student of mine. I mean, we had very great moments when we went out for excursions and things like that. And today, Sainath is blessed with a girl, a daughter called Akshara. And it's so beautiful to see the entire family so complete, right? And I want the spotlight at Sainath right now, and I'll be introducing Sainath to the entire people who have assembled here. Thank you, delegates, for joining us. And this expert series also started from the first week of August, and we have been going continuously on that. So very, very happy and proud of that. So can we have the video at Sainath, please? Okay, so Sainath is our expert speaker, and the topic for today is going to be hair reconstruction in this new era. He's an oral and maxillofacial and facial cosmetic surgeon. He works on cleft lip and the cleft face, along with the craniofacial deformities. He has undergone training in 3D navigation from Germany. He has done his fellowship in hair transplant surgery from USA. He has got clinical fellowship in cosmetic surgery from Bournemouth. He has many international publication and chapters and textbooks to his credit. He is also a Botox and a derma filler expert and has held numerous posts in various organizations. And he's also a fellow of the Royal College of Surgeons, Glasgow. So with those few words, I want to invite Sainath on the screen. I'm just going to put the spotlight at Sainath. And thank you, Sainath, for accepting our invitation, and welcome to our Pamper Yourself series. The stage is yours, dear.
Now I'm, to be honest, left out with no words after Dr. Vidyaa Madam introduced me. I think it was 1997 when I first saw her as my teacher. She used to teach me tooth carving and then later on clinical subjects. As she told me, first time I assisted a small cyst surgery, it was my start. Indeed. Indeed, it's an immense pleasure, and thank you very much, Dr. Vidyaa Madam, for inviting me for this wonderful team-led concept of programs. And it's a Saturday morning. This is the only time I take really off during these pandemic days, because after this pandemic started, I'm not working on Saturdays, Sundays. All I do is just sleep. Madam asked me to give a lecture, so I have to get up really early. So excuse me, my throat is bad and other things. And once the pandemic is started, I've been giving lectures through webinar for all the medical profession that is into my specialty, into other specialty of cosmetic surgeries, craniofacial. And this is the first time I'm coming into the normal people mode. So I'm little, I don't know how to even, prepare a lecture to avoid many medical terms which you cannot understand. But something I've done. Hope it'll be a take-home lesson for all of you. Good morning, everyone. I'm Dr. Sainath, maxillofacial, cosmetic, and hair transplant surgeon. I've been in this field for almost 15 years, not more than that, to be honest. So today's is about hair restoration surgery. Why I'm calling this surgery into this era, because if you can take a decade back, I don't think so many people will be undergoing this hair restoration surgery. Now it is like a very common surgery, and because of the people, knowing knowledge about the hair transplant and hair loss and hair fall, then becoming much more, cautious when they have the hair loss. So that's how this new era is trending into hair restoration surgery. People do walk in. In fact, with their parents, they come, my son is not getting married, and my daughter is having a hair loss. She's showing scalp. So it's like that. So the consciousness of the patient is becoming more, especially in this kind of. So I always ask, do women like bald men? The earlier answer was no, but often I see in many pubs and clubs, most of the people have shaved head, even if they have hair, because this is the new trend. So I sometimes feel that my business is going to go down if women starts liking bald men. Okay, and my answer is always yes, because I see it. Okay, before I get into the hair restoration surgery, I would like to tell you all, there's a difference between a hair fall and hair loss. When you go to a doctor and you complain, hair fall, it's a normal. Hair fall is a normal physiology. That is, everybody has that cycle. The hair grows, it becomes, converts, it is called as an anagen, which is called the healthy hair. And then it converts to telogen and then catagen, it falls, and then a new strand of hair will come. This is an aging process and it happens for all the male and female. There's no predilection. Whereas hair loss is a pathology and mostly a hormone related. And then it can be even a stress and other factors like medical conditions, which can cause the hair loss. And this is a permanent. You will not get any kind of regrowth. Whereas hair fall, you get a regrowth. And this hair loss pattern is predominantly into male because androgens are the main hormone which is responsible for the hair loss, and they are mainly present in the frontal to the mid vertex of this region. It is also in the form of dihydrotestosterone. This is the hormone which is present in the male. That's why most of the male has baldness and female doesn't have baldness. And I've been seeing all my patients who come, they complain that, I went to Pamper, I went to other state when I was here, my hair was fine. I went there, the water is not good, the climate is not good, my food is not good. Yes, that sounds good when they give you a complaint like that, but it's not true. The truth is, it's again age changes, the hormone related and genetic patterns. All this makes a very important role in hair loss. That's why predominantly a male will have a hair loss than a female. Yes, we do have a female pattern hair loss, which I'll be coming in later slides. So first of all, when Vidyaa madam introduced me, she was my student. I started my profession as a dentistry. And how can I become a hair transplant surgeon? What is the role of a dentist doing a hair transplant? Is it legal to do? Is it not illegal to? This is a common question before anybody drops in my clinic. They'll ask you, are you qualified enough? In dentistry, there is a specialty called as oral and maxillofacial surgery. Maxillofacial means entire head and neck and the face. Okay, it's called maxillofacial and craniofacial now. So we have a subspecialty after doing our MDS, like you can get specialized in cancer reconstructions, cosmetic surgery, orthogenetic is like jaw correction surgery, then traumatology is accidents, and cleft and craniofacial is birth defects. I'm specialized in cleft and craniofacial, which I've been operating in SRM, Institute of Medical Sciences for almost 10 years. And all my surgery was free of cost and been funded by Smile Train. And in cosmetic surgery, since my interest more towards the cosmetic surgery, in that there is a separate specialty called as hair restoration surgery. So I've been specialized in that, and I'm following and I'm practicing in my day-to-day life. Not only hair transplant, I do all kind of other surgeries like facelift, neck lift, brow lift, nose corrections, everything. So hair transplant surgery is nothing but it's an art and craft. See, I'm trying to maximum avoid all kind of medical terms so that it is easily understandable to you. Hair restoration surgery is an art and craft in a surgical procedure and the science where the graft is the hair along with its root, which is harvested from the permanent hair bearing. What is called as permanent hair bearing is, you would have seen baldness from front to the vertex, but behind, it's harvested from the permanent hair bearing, which is behind the head, or we are doing now even in the chest and the beard. So these are the permanent hair follicles where we harvest and implant in the area where there is baldness, okay? And the hair starts growing from there. So everything has an history. It started right from 1822 by Dieffenbach in Germany. And coming to alopecia, before I get into this kind of surgery, I'd like to broadly explain what is alopecia. Alopecia is nothing but baldness, devoid of hair, any part of the body, need not be scalp. It can be even in the mustache, it can be even in the beard or anywhere. It's called as alopecia. So androgenetic alopecia, the name itself is like hormone-oriented, hormone-related alopecia, which is the commonest male pattern baldness which you see in everyday's life. And it starts from almost 20 years and goes up to 45 years of age. And this is the duration where the patients will have a hair loss due to genetic. Why it is called androgenetic? Because androgen is a hormone and genetic. So mostly it comes through genetics. And again, stress and other medical conditions do play a role for this androgenetic alopecia. I'll tell you how it looks also. And second kind is called as alopecia areata. Earlier, it was diagnosed as a ringworm disease, or the people will have a small patch in the beard or in the mustache area, thinking that they started treating with ringworm antimicrobial. But later it is found that it is not ringworm, it is an autoimmune. That is, your body is fighting against your own hair or whatever system. That's why it's called autoimmune disorder. Okay, especially people with high immunity. These kind of alopecia areata comes, and there is no male or female, both have equal predilections. And traumatic alopecia, the name sounds, it's from the trauma, any accidents or burn, they lose the hair. That is called as traumatic alopecia. And diffuse alopecia, I'll come later. I'll tell you what it is exactly. It is called as totalis or universalis. So androgenetic, this is how it starts. The hair starts thinning and then it becomes shortened. As I told you, it becomes, it's mainly a hormone induced. Anagen is the healthy hair. Telogen is the next step of alogen, where the hair becomes thin and short, it will not grow. And then catagen. So catagen is the falling hair. There's the three types of hair which you see in a scalp. So this is how, so the hairs become short, thin, and then it starts falling. And it's very slow process. Sometimes if there is too much of hormonal disturbance, it can happen almost in 1 year to 2 years, the entire baldness. Otherwise, it's a very, very slow process. Pathogenesis means how it happens. Again, I told you testosterone is a male hormone, which is responsible. But when I was mentioning even the female has hair loss, that is when if they have the androgenic activity, it's also called as hirsutism. And hope many of the females, they go for hair laser removal of the mustache or near the beard area, especially the female. They'll have more amount of the hair in the leg, almost like male. And the beard and the mustache, small hair is the most common clinical condition you would have faced. And those people, those females will develop hair loss even in the scalp. That is because of the influence of androgen hormone. It should be less than 10%. If they exhibit more than 25% of androgen, and all these people will develop a male kind of secondary sexual characters. That is called as hirsutism. And those patients will have scalp baldness. Okay. Now coming to alopecia areata, I told you there will be small round patches. Earlier they say it was a ringworm, and then now it is more like an autoimmune disorders. There's a good part and a bad part in this. If you treat it immediately, you will get the hair back. You don't have to do anything else. But if you allow to spread, it starts spreading into the scalp. That's why the treatment is less than 50%, more than 50%. And mostly we don't do any kind of surgeries for this. I refer to a dermatologist. What he does is intralesional steroids, 2 or 3 injections in a monthly duration. What happens is after 6 months, the newly grown hair will be mostly white in color, and then they'll shed, and then normal black hair will start coming. If it is spreading into the scalp, a caution should be taken, and a serious conditions, serious medical intervention has to be involved. And that specialty is mainly into dermatologists. And surgery, I will not advise, because most of them, 90% of them, get recovered. But on early observation and early intervention. Next, let's see, this is a treatment like how under 10 years of age, over 10 years of age, how does it respond? This is how mostly. Immunotherapy, what we give is really for a high immune status people. We calm down the immune status of the people by giving immunosuppressants, especially steroids. So that is the treatment. And as I told you, 90% of the people get treated well and they'll be happy. The question is, will it come again? Yes, it can come anytime, but you have a remedy for it. This is called as diffuse alopecia or alopecia totalis. Mainly, again, this is also an autoimmune. And if you especially notice, there won't be any single hair in the face, even in the eyebrow or in the mustache or the beard area, either chest or the scalp. And this is a difficult condition to be treated, and there's no treatment for this. Generally, we ask them to go for a wig for the scalp, and for the eyebrow, they do a tattooing, and for a mustache also, they kind of do a tattooing or beard, scalp micropigmentations. There are some cosmetic procedures which can be done, but this kind of condition is not treatable. So this is how we classify, and this is how the baldness starts from stage 2 to stage 7. Normally, stage 7, stage 6 is not a good candidate for hair transplant surgery. But now we're harvesting from the chest and the beard, so we could be able to cover almost 90% of stage 6 and 7. So hope this photo or the picture will be, you can understand it very easily. From stage 1 to stage 7. Normally, stage 1 is fine. From stage 2, we calculate it as baldness. And this is how it's been classified. So coming to the female pattern, it is different from the male. It won't start on the sides or on the frontal line. In females, the frontal line remains the same. It always starts from the frontal fringe, that is a centimeter from the frontal line, and then it goes up to the vertex. It starts as very scanty and then becomes diffuse as it grows. And this is how in stage 1, stage 2, stage 3 at once. And if you ask me, do you have a treatment for this? I will always recommend to dermatologists because they are expert in doing it. I'm not the specialty who can handle this. They need a kind of hormone therapy. And most of the time, they do with the growth factors, especially the platelet-rich plasma, which has been injected, which I do that. We take your own blood and we extract the platelet-rich plasma, which got many factors, which I'll come to you in the ongoing presentation. So which can regrow, and I won't say regrow, it can thicken your hair, and at least it will stop in the stage where you are. It will not allow you to go further, hair loss. And after that, if you can't, surgery is not a really good option for a female pattern baldness. So we do something called as micropigmentation or a camouflage technique, kind of a tattooing on the scalp so that it appears black and they don't show the scalp. It's a semi-permanent. They may have to keep doing every 2 years. So coming to the medication, this minoxidil and finasteride is a common for male. Minoxidil we can even for female, but finasteride, it's totally contraindicated in men. Minoxidil is mainly given as a topical application, which they have to, for a female, we give 2%, and for male, we give 5 to 10%, depends on the hair fall. And not only that, yes, obviously, diet for healthy hair, but I don't know how many people really follow this. I keep seeing many of my patients, they really take care of the skin for a month, and after that, slowly, drain down, following the instructions, following all this healthy for the skin and the hair. So what is this platelet-rich plasma which I was talking about? So in this, it's a daycare procedure. It's like a OP, walk in, walk out. If people do come before the work, they get injected and go back doing the work. So we extract around 20 to 30 ml of the blood, and we centrifuge it. We separate into plasma and the red blood cells. From the plasma, we again further do a centrifugation and segregate the platelet-rich plasma and platelet-free plasma, and we discard the platelet-free plasma, and we inject it all over the bald area. So you can see there is some amount of the regrowth, and the thickness of the hair increases, and it will totally stop your hair fall. It's a very good procedure than taking medications, but it has to be done almost every month for 6 to 10 sittings for the complete hair for hair loss to stop. And this platelets rich plasma contains all these kind of factors, not only for the hair, for the skin, for the bone, for any kind of organs which in our body. The platelet rich plasma is a big time booster in developing any kind of loss, right from endothelium to ectodermal problem, any kind. Okay. In fact, for bone regeneration, nowadays the latest treatment is extracting the platelet-rich plasma, and mainly for arthritis condition. They do a very minimal invasive, just a needle point entry. They go inject, and I've seen and myself experience, because I developed a hip arthritis, and I'm doing well right now. Just with one injection, I just stayed back for 5 days in my house. In fact, they told me I have to go for hip replacement, but the one injection, I'm still surviving for 6 years. So not only for the hair, many parts of the body, this PRP is very, very essential, and it's really doing a good job. Coming to the baldness, the question is, why do you treat them? Mainly, the patient comes with low self-esteem. They cannot face the public so easily, and most of them keep complaining. It's very difficult to see somebody. They always keep looking at my head. It's a kind of mental distress what they undergo. And as I told you, where we can harvest, this is the safety zone of harvesting. You cannot harvest anything above or on the sides, especially even not even front of your ear. So we have to restrict anywhere from exactly from the ear and then the white line area. So this is the area we can harvest. That's why I told in stage 6 and stage 7, it was difficult earlier because we won't get much of graft. But now we are taking from the chest and the beard. It is possible for us to even cover the vertex and the area behind. So there are 2 types of hair transplant surgery. The earlier was follicular unit transplant, where from behind the head, we take a long strip, almost 20 centimeter to 25 centimeter with a width of 2.5 centimeter. And I have a technicians who can sleever and separate each graft. And this is how we take it. Maybe it sounds really, it looks very scary. That's why I don't want to keep that picture for a long time. So my technicians, they slowly sleever it and separate as individual grafts like this. It can contain a single follicle or 2 follicles. And the end, you can see one small round bulb. That's called the follicle. Without the follicle, you implant the hair will not grow. So that follicle, the black, dark circle kind of stuff, you can see there's a single, there's a double, and there's triples. That's how we implant it. And after taking the strip, we do a suturing, and there will be a permanent scar of small line, which you will be able to appreciate only if the patient shaves his head. Otherwise, it is not visible at all. And as the technology starts growing, the follicular unit transplant has become follicular unit extraction, because the patients are finding it very difficult as a big surgery where they can take a strip behind their head. And, sometimes there's a neck stiffness which can happen. And, the scar can become more thick, and it looks very unpleasant when they shave. So there's a couple of big people who started with small size punch. I'll show you what is a punch. Nowadays, the total procedure is done under local anesthesia. We won't give you any kind of sedation or anything. So you will be well aware of what is going on. In fact, you can even listen to the songs if you want, if it's boring. because these procedures takes 8 to 10 hours for me. And I do, if I start at 9 o'clock, I complete by evening 5 to 6. Maybe in between a half an hour, we call for lunch. And we continuously do under microscope. So miniature size punch, 0.9 millimeters. So just think the size of the punch. We go punch the individual hair, we take it, and then we implant it. Okay, I'll show you that. So this is a little bit into medical terms, which I don't want to go. And this is the punch. See, can you see a hollow thing inside? So it goes, punches, extract the whole follicle, bring it out, and then we segregate into single, double, and triple follicles, and then we implant from the frontal to the whole baldness area. This is how we prepare the donor side. Don't worry, I'm not going to show you any kind of scary pictures. And we mark where we are going to harvest. And this is just giving of local anesthesia. It's a small, I use an insulin syringe, so just think how much of the pain it will be, because most of the time, diabetic patient, they take insulin syringe and inject themselves. So that's amount of the pain you'll have. So I won't call this as a much painful procedure. Yeah. This may look scary, but I can just show a small glimpse of how we use the punch and extract. If you see, the punch will go into the follicle and it will pop out. See, it pulls the hair out, the follicle. Hope you can appreciate that. And so this is how we extract the follicles. See, if you can see triple, double, singles, lots is there. So this is how we extract the follicle. And I have a technicians, surgical technician, my staffs. They sit under the microscope and they separate as single, double, and triple. So mostly the front line we'll cover with single and doubles. We don't use triples or quadruplets because it looks very unnatural appearance. This is how they segregated the follicles, and everything is stored under 2 degrees centigrade because the grafts can survive up to 6 to 8 hours. So once we start harvesting, we have to implant it before 8 hours. And this is how the appearance of the thing, and which will totally go off. I mean, you will not see any scar after 10 days. You will not even find where the surgery has been done. That's the advantage in FUE, whereas in FUT, you can't do that. So then we start the marking where all he needs. And then this is how post-implantation, we implant it very close so that when it grows, see, this is what I want to show you. Can you see on the 10th day where it has been operated? The patient will have zero pain. He will not complain of anything. And this is how we implant. In my case, most of this hair transplant surgeons, I don't want to name them, they just harvest and they have technicians to do the implantation. This is how it's happening every part of India. I'm sorry to say this. I sometimes feel ashamed of, allowing a technician to do managing the patients. I myself, being a surgeon, I don't give a chance to any of my technicians. I do everything myself because I know how much of the distance of the graft should be implanted, what is the angulation to be implanted, whether the graft will survive or not. If there is a bleeding when I'm implanting, I am the person who can able to manage and correct it. It's not my technicians. And I am the person who can give a local, and I'm qualified to give a local anesthesia. And they are the nurses and technicians, how are they doing it? But still, this is the outside world which is going in. I'm sorry to say, I have to put this word to common people. Yeah. This is just to show you a stage-wise, this stage 2 baldness where you can see only on the sides. And this fellow is like a little, we do a hairline designing in a different way, but he wants it to be more straight. So I have to implant like this. And this is the 10th day. You cannot expect the same kind of density like how your natural hair is. There will be 20% of compromisation because of the spacing and the gap. when we implant. But after the growth, you will not see any kind of spacing. That also I'll show you. It takes 8 months. You see, you will not see much spacing. The kind of stage 2. This is a stage 3 patient. This is also stage 3. This is after the surgery, 8 months. This is stage 4, 8 months post-surgery. This is also stage 4, 8 months before and after. This is also stage 4, before and after. This is stage 5, before and after. Stage 6, yes. This is the one which I want to tell. This was a really challenge for me because I took this case because he got really good grafts, and I promised him I can do 75% coverage, but 25% of vertex, which I can do it on the second sitting, but I cannot promise. He said, yes, it's all up to you, doctor. You just go ahead. All I need is my hair. I want to be like, I'm very young, but because of this baldness, my son, my daughters are asking me. So he flew all the way from Canada and he came here. He's a physiotherapist. So I did a surgery. It took almost 12 hours for me to complete the whole, almost till the vertex. And this is the 10th day appearance. And all these things will fall off in 1 month. And your growth starts only from 3rd month. Because from 3rd month to 6th month is called as a growth phase, where you will have every month 1 centimeter will grow. From 6th to 8th month, there's a maturation phase where the cortex grows, where the hair becomes thicker, and that is so 6 to 8 months is the correct time where you can see your results after post-transplantation surgery. And this is how he is now. That vertex area, which I said I cannot cover, he said, I don't want, doctor, I'm fine with the frontal look. So if needed, definitely I'll fly back to India and I'll get it corrected. So this finishes with a scalp and a vertex. Yeah, I'm sorry. This is again isolated vertex. So we did it, and the whole thing is closed now. These are all permanent surgeries. I mean, this will last longer. Medical journals and medical reports, they say 20 to 25 years. Again, medical conditions too matters for the long-lasting results. And not only the scalp. See, this is my specialty called cleft lip and palate. This patient I've been operating for the past 15 years, and his only concern is the mustache. Being a male, mustache is really important, and especially if you have a cleft, and that area will be devoid of hair. So I did a surgery for him, and at the same kind, we implanted, and this is again another case of mustache transplant. So this is before and this is after. In this case, I did a little bit of nose correction as well. And cosmetic beard, nowadays the trend has been like more towards the beard. So patients start coming for, they want a sharp beard and, thick one, especially during the lockdown, they all want to grow the beard, and especially these party guys, they want more beard. So we do even cosmetic correction of the beard, and it comes out well. Eyebrow and eyelash, I don't want to show you eyelash because it's a very sensitive technique, and I think it will be a little scary if I start. That's why I'm limiting myself to eyebrow transplant. Mostly this happens in females when they start to, because of the stress pattern as well. They start having a thinning of the eyebrows, and eyebrow starts falling, and they camouflage either with a pencil or something. So I thought, why can't I do a transplant for eyebrow where that it'll be really good. So again, it's a site sensitive because you have to implant along your existing hair. You cannot just implant like that where your hair goes like, witch look appearance, witch. into a straight and it comes. And the only problem is you have to keep trimming because your hair, this hair is going to grow, whereas the high eyebrow hair doesn't grow so fast. Angulation of the placement is very important. That gives you the perfect eyebrow looks. And they have a high failure rate because unless you're really skilled enough to do it, you cannot go to the depth. And see, the depth of the follicle which is placed really matters. If you're not going to place it in exact depth, it's going to land up with failure. You may have to repeat the procedure again, which is really disgusting for the patient every time you keep calling them operating. So you have to be really careful when you operate. And this is one of my patients who starts losing hair growth. And she came to me and I did a transplant, and I'll show you 8-month result. This is how now she is. So if you see every hair, it grows along the angulation of the natural pattern. You can't just implant in whatever way you want. So I think with this broad concept of hair transplant surgery, I think you would have understood something about it. I conclude my presentation with the last thing is a complication, because everybody comes to the clinic asking, what are the side effects? What are the side effects? What are the side effects? So I'll say all these side effects are common. Scarring of the donor area, adverse systemic effects if the patient is having a systemic problem like hypertension or a heart problem. Bleeding, I won't say it's a complication, but we can arrest it. That is during this time of surgery, not after the surgery. Failure of the grafts, if you're not going to maintain properly, if they're going to develop an autoimmune disorders, the failure of grafts can happen. Infection can happen in any kind of surgery. It's the surgeon's utmost responsibility to maintain the sterile theater, sterile gloves, and a whole sterile procedure. That's how we control the infection. And the latest is the robotic surgery, which I was also a faculty in US, in California, along with Dr. Zara Wasserbeer. She's the president-elect for Hair Restoration Surgeons of International Association. So I've been called as a faculty to do robotic surgery alongside, but it's not common in India. It's not common in India. It will take a long time, because here nothing we can operate. It's everything the computer which operates. The machine goes, punches the follicle, and then it brings back, and then it segregates by itself, and it implants. It'll take at least another 10 to 15 years for the development. Because I'll tell you, I harvest 1,000 grafts in 1 hour. Whereas for this, it takes 6 hours to harvest 100 grafts. So there's a difference. And this is our last meet. She's the international president. And recent advances, stem cells and adipose tissue derived mesenchymal cells. Stem cells, you all have heard stem cells, especially adipose tissue means fat. So the fat layer is one of the main stem cells, which the study is going on to regenerate the hair follicle, especially. And then they start injecting the germ cells into the scalp to see, but it's still an animal study process. It's not common to human. So conclusion, it's a very challenging specialty. You need at most very good training and practice, because surgeries are going to last more than 10 hours. You need patience and patience, both. You need experience, at the same time you need to have patient to do so long procedure. And end of the day, it's a patient satisfaction what you get. And I get through many wedding invitation cards. Sometimes I plan to start a matrimony center where I can get more patients of hair transplant surgery. I'm just joking, I'm not serious. So with this, I finish my topic, but I want to tell this. I shall be telling this with a sigh, somewhere in ages and ages hence. Hence, 2 roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. Robert Frost. Why? Because when started as a maxillofacial surgeon, everybody was doing traumatology, cleft and cosmetic surgery, cancer surgery, reconstruction. But in Tamil Nadu, I was the first person to start up with a cosmetic surgery and hair transplant. You can ask my association as well. Now there are thousands of maxillofacial surgeons who are doing it, but I took the path which is least travel and no one travel. So this made a big difference in my career. And I thank you very much, especially Dr. Vidyaa Madam, for giving us such a wonderful opportunity. And indeed, it's an honor on the Saturday morning to give us such a kind of lecture. Thank you very much.
Thank you so much, Sainath. I mean, absolutely awesome present. And as always, proud of your work. I'm sure our team would have understood your worth today. Because I give them only the best. And, it's so lovely to know that, you have been the #1 in Tamil Nadu, and I know you're the best. In fact, what I failed to tell in the beginning, I would want to tell now. Sainath's father is a very renowned dental surgeon. What I liked about Sainath is many a times, sometimes these children who have star parents, they sort of, try to live under that kind of, what shall I say, an umbrella, and follow the parents' shadows and, make life easy for themselves. So that's how I would say. But Sainath, in spite of taking the same speciality of his father, he wanted to make a name or mark for himself. And that is what made Sainath so different and so unique. So I have known him for almost, I should say, 20 years now. And to see him grow.
It's 24 years, 97.
Okay, so 24 years, and it's so nice to see him grow. And the best part is that, our relationship, our friendship has been unique and has continued over the years. So I always feel there is a little of what you can contribute, and so happy that today he is, doing the same for the next generation. And that gives a lot of pride, because, when you want to learn, I think the universe helps the teacher appear in front of you. And he found his way. He took the less credit path, but he found his way abroad, and then he learned, he mastered, and he practices here in Chennai. So, it's a complete homecoming. And there are many people who have given you great feedbacks, Sai. I'm going to read that. Of course, Dr. Mini ma'am has said it's absolutely fantastic. Dr. Lakshmi says, congratulations, nice. And Dr. Menaka says, very informative and interesting lecture. And Dr. Sonali says, thank you, sir. Very informative lecture. Jayashree says, very informative.
Sonali is our college?
Yes.
Okay. I know.
In fact, you had even...
I operated her case as well. I mean, it's a job, something. Hi, Sonali. Good to see you.
In fact, Winnie was also here. I don't know if Winifred Christie. So Winifred was also there in the lecture.
Winnie was there.
Yeah. Winnie was also there. Yeah, she was also there. And for people who know the worth of this lecture, it's not easy to just get expert speakers. But the kind of relationship I share with people, they're ready to come and talk on the forum. So thank you so much, Sai, for taking time out of your busy schedule. I know his daughter, Akshara, is right now, going to compete for the national games, especially in skating. Am I right, Sai? So she is, so she is there in her session, and from our team, it's all good wishes to Akshara. I will call her baby only. And it's always pride. So when you know that Akshara is doing well, you know that she has got all our prayers and wishes also. And definitely, Dr. Lakshmi, I will be sharing his contact. Thank you very much. I would be doing all that. You can ask me. I'll be sending it across. Thank you so much. The whole idea of bringing in expert speakers every Saturday is to give you a complete understanding, because I personally feel if you want to know a subject, you should really ask the experts. Google does not become the know-it-all place. You need scientific evidence and scientific knowledge behind whatever you're reading. And I feel that comes only from people who do it and who do it often. And that is why I get speakers in that field who are masters, who are real experts in that. And thank you so much, Sai, for working out this wonderful presentation. I had put in a
In
word
fact,
to Sai saying that
it was really difficult for me to prepare this, because in a medical fraternity, it's very easy. But I don't know how to make, not everybody is a doctor here. So I was wondering, how are they going to understand? So I hope I try to, squeeze to layman terms and then present.
Absolutely, absolutely. That's what I was telling. In fact, I had told Sai, please, avoid any medical terms if possible, and no show off so much blood, because let's not scare people. But I guess, it was so simplified, and it had all the contents at the same time. It was like, we understand how is it to move forward in this particular specialty. And as he very rightly said, the androgen, the male hormone, is right now responsible for a lot of hair loss. So previously, if women were only considered considering hair loss, today I feel a lot of men consider hair loss. So, there are a lot of people who really are concerned. And I know personally many people whose marriages have not happened just because they don't have hair. I personally know that. So I'm sure now you're going to get many clients coming up to your practice, because, it is a win-win situation, right? You want everybody to be happy around you. And then you have a happy patient, they become your brand ambassador. So every happy patient is your brand ambassador. So that is something which is very nice. Thank you so much, Sai, for taking time out of your busy schedule and being there for all of us. And convey our love and regards to Prashanti and Akshara. And I will keep this floor open for people to ask any questions if they have.
Yes, please.
You can unmute yourself and ask Sai any questions if you have. So,
Dr. Sainath, that was an absolutely fabulous talk. I am a medico, so I understood everything. That I'm an FRC path. And plastic surgery is my forgotten dream. In 1960, when I wanted to be a surgeon, the male chauvinist absolutely blocked me. I couldn't do plastic surgery without general surgery. And men at that time wouldn't give me a seat.
Thank you so much. I'm really sorry that you didn't get it, ma'am.
I know, when I was listening to you, I was just thinking, this is absolutely my forgotten dream. I enjoyed every bit of it. Let me wish you all the best. Fabulous.
Thank you so much, madam. Thank you so much.
Dr. Mini is 80 plus size, so it's like blessings.
That's what
I personally feel, blessings of elders is priceless, and Mini ma'am is a very active member of Get In Get Fit, and she comes for everyday exercises, and she's a part of all our expert speakers, and whatever she says, I feel it's a blessing. So when she says, it's marvelous, that means it has really touched many hearts.
Thank you so much. Thank you so much.
Great. So any other person want to talk? Otherwise, we'll be ending the session shortly. Okay. So thank you so much, Sai. And absolute, it is with so much of pride I say that we had a great enriching session today on hair transplant, reconstruction in the new era. And what is so amazing is, we could see the educational, whatever you have gone or scaled greater heights in your personal field, which you've taken. So congrats, and keep rocking as always, and all the best from our series. And waiting to catch you on the other side of this session. So take care, love you, and God bless.
Thank you. Same here. Bye.
Thank you.